See, many women suffer alone. People who are close to you says it's all in your head. You can lose your happiness, your self-confidence just because.
Welcome to the Can or Not podcast, where we question the can or cannot when it comes to your health and wellness. This podcast is brought to you by Akeso. Today's topic is PCOS, or recently that has been renamed to PMOS, a condition where many women hear about but do not fully understand. Joining us here today is Dr. Suganthee from Springhill Clinic TTDI. She is a registrar ONG who has experience treating hormonal and women's health condition for more than 20 years. She also practices functional, regenerative, and anti-aging medicine. Thank you, doctor, for being here with us.
Hi, good morning. And thank you so much for inviting me today to give a speech on a very important topic, PCOS, or what they are calling now PMOS.
Right, before we begin, doctor, although I'm a guy, right, but let me ask you something that many women may wonder. Are irregular periods, constant fatigue, and stubborn weight normal for women? Is it a common issue? Okay,
when you're talking about all the symptoms, this indicates a woman is having a hormonal imbalance. This is not normal. This is common among women. So, and usually you can see in conditions like PCOS.
Okay, and in simpler terms, what exactly is PCOS or PMOS?
PCOS stands for polycystic ovarian syndrome. Okay, recently this month, all right, and from the medical journal, The Lancet, it has been released that the word PCOS has been changed to PMOS, which is polyendocrine metabolic ovarian syndrome.
Okay.
Right? So usually women who have this do have irregular cycles, signs of hyperandrogenism, which is high male hormones, androgens or testosterone, and an ultrasound picture which shows there's a tiny little follicles around the ovaries which are immature cysts or mature follicles. That's what they call it. So this is what you mean by PCOS. And usually this PCOS has an endocrine issue associated with this, metabolic issues, reproductive issues, psychological issues, and even dermatological issues along with it. There's inflammation also involved in this condition.
And how would, with all this condition that you mentioned, right, what are the common symptoms that are very easily noticed for a woman, you know?
Right. The common symptoms, people will come with irregular menses. That's a common one. All right. There are also women who comes with acne, which can be facial acne, body acne. It can be facial hair, body hair, difficulty getting pregnant, weight gain. They also can come with certain psychological issues, can have anxiety, eating disorder. They can have depressions.
And can someone have PCOS without even realizing they have it?
Oh, of course. There are many women don't realize they have PCOS because these symptoms develop very gradually. They develop slowly over many years, and they think this is normal for them. And nobody actually tells them until the condition actually becomes serious. Then they think, okay, finally I need to go and see somebody.
Why do many women with PCOS struggle with weight? Is it very common, or does struggling with weight generally leads you to PCOS?
Okay, weight issues associated with PCOS. All right, this is a core issue, is hormonal imbalance, and major thing is insulin resistance. That's what we are talking. And yes, it is very common among PCOS or PMOS patients who have weight gain. Okay, so when you're talking about weight gain, let me just go through a little bit about insulin resistance, all right, because you have to understand why you're having weight gain. So in a normal people, when, for example, you take carbohydrates or sugar, so what actually happens, it goes inside your system. These carbohydrates will be converted into glucose. So this glucose go and knocks the door of pancreas, and it says it release the insulin so that this glucose can be taken up into the cells to convert into energy. So that is what normally happens. But in insulin resistant, what happens when there is glucose, there is insulin coming out, but the door is not opening. The channel is not opening for the uptake of the glucose to convert into energy.
It's not functioning right.
It's not functioning right, exactly. So what happened? This insulin keep going up high and high and high. So when insulin goes up high, eventually what happens? The glucose will be converted to fat.
Right.
So this is a bad fat you're talking about, not the good fat. So it becomes visceral fat, your tummy fat, belly fat, central obesity. Also causes your triglyceride, your cholesterol to go up. Your inflammation is going to go up. And also had feedback on other organs as well.
So does that mean once your PCOS is somewhat fixed, would all this just automatically go away?
Okay, you must understand PCOS can be controlled. It cannot be cured.
Right. Okay.
So if you want to fix it, you have to fix the insulin resistance part.
Right.
And some people may have more than one factor involved in this. So you have to address it accordingly
Right.
and treat it.
So assuming if my partner has all these symptoms and everything, how can you be sure that this girl or this woman has PCOS? Is there a way you diagnose it professionally, or what should we do?
See, for a doctor, how we diagnose PCOS or PMOS, okay, first, we will look at the history, medical history. Okay, we'll look at the signs and symptoms of PCOS, whatever I mentioned earlier. We will do a blood test and sometimes an ultrasound. But based on books, okay, there's something called Rotterdam criteria. There's 3 criteria involved in this. The first criteria is irregular menses and ovulation, or cycle which is more than 35 days, or you have less than 8 cycles per year. That is the first criteria.
Okay.
The second criteria is you have signs, and this is clinical and biochemical signs of hyperandrogenism. That means high male hormones, testosterone or androgens in your body. All right. So when you have this, you also can have by a blood test, or you can also have the acne, excessive hair growth. This can be one of the symptoms as well. And the third criteria will be through ultrasound, which is when we do a scan, we see the tiny follicles around the ovary, which are immature, small cysts, is what you call actually, immature follicles which fail to grow. It creates a pearl necklace kind of picture in the ultrasound. So this is one feature. But recently, they have included one more criteria for clinics or places where they don't have ultrasound. They do a blood test called AMH, anti-Mullerian hormone. So high AMH also indicates a person have PCOS.
And how accurate would a test like that be?
Which test are you talking about?
You mentioned about the AMH.
AMH is pretty accurate. We don't really do it for teenagers, but you are talking about mid-age groups where the AMH is usually drops down. So it can be very high, then you know it indicates PCOS.
Right.
So out of these 3 criteria, you only need to fulfill 2 criteria. That means you don't need all 3. 2 out of the 3 has to be present for you to be diagnosed with PMOS.
Oh, okay. And you did mention just now at the end where you said middle-aged woman, and how would you categorize this age group? Like from what age to what age?
So the middle age, usually we're talking about usually around, from 30 onwards, 30 to 40, 45. These are the middle age group women where their AMH slowly drops over a period of time.
Okay.
Yeah.
And that is where you notice there is a higher diagnosis.
level.
Right.
Yes.
Okay. Is PCOS curable?
Okay, there is no cure like what I mentioned for PCOS. It's more of a lifestyle management.
Okay.
All right, you can keep it under control. So together with lifestyle management, you have some medical management along with that. Seeing your doctor, getting some supplements. All this will keep your PMOS quiet.
In today's day and age, right, with AI and everything, is there a specific reason why do women ignore the symptoms, or they feel like, hey, it's actually normal? Do you think a lot of women do that?
Oh, actually, they don't ignore the symptoms.
Okay.
Of course, most of them don't realize they have an issue. They think it is normal for them. They listen to their peers. They listen to their family members saying, oh, this is normal. This is what I had when I was younger too. Nobody realized that these issues that I mentioned earlier, these are not a normal thing. They think this is normal for a woman. So they tend to ignore it for that reason.
Could you think, is it because they think that they are kind of healthy, they're functioning somewhat okay, it's just here and there,
Well, doesn't mean you're functioning well, you're healthy, right? You have to do a medical checkup to see what is actually going on with you. If you have any symptoms related to PCOS, then definitely you need to go and consult a doctor. Only then you will know whether you're healthy or not.
Okay. Without sharing any personal information of your patient, right? Is there a common situation where you see it in women with PCOS that they might have it but they don't notice it, and then And then it's a very common reoccurrence, that you see on a day-to-day.
See, many people think women having fatigue, acne, weight gain, or a bit of anxiety or depression, it's all kind of hormonal issues. It's normal, So, but when they have certain issues, when it becomes severe, when they come to see a doctor, they always think they are separate issues. So they come for irregular menses, but they might be having an acne, they might be having depression or anxiety, or weight gain. So they think all this belongs to a different entity. They don't realize it's all belongs to one same umbrella.
Right. So they are systematically just treating whatever problem.
Exactly.
Right?
So they have irregular menses, they go and see a gynae. They have acne, they go and see a dermatologist. They have psychological problem, they go and see a psychologist. Depression, anxiety, eating disorders. So they go and see the psychologist. And then if they have weight-related issue, they go and see a physician or a nutritionist.
Right.
But what they have to understand, all this issue is connected to one
There's an
problem.
underlying issue, right?
Insulin resistance, that's what we are talking about. And this insulin resistance causes multiple hormonal issues. So ideally, you need to see probably one good doctor who knows something very well about PCOS, and they can manage all your symptoms at one go. And just to share with you a story, all right, I do have a lot of teenager girls coming around having anxiety, depression, who are already on medication for it as well. So when they present for irregular menses and you find out that they have all these issues and you're trying to explain to them after doing several tests that this is related to PCOS and you manage their hormones and they get well within a couple of months and they actually come out of those medication for anxiety and depression. This is actually can be quite overwhelming and empowering for this woman once they know what actually they are having.
Okay. Is there like a common mistake where people make when they are managing this PCOS thing?
Okay, the common mistake is they listen to what people says, okay? And they think one pill will make a miracle, I just have to give them one thing and it will cure their issues.
Okay.
So this is not something which is right. They should understand that it is a multi-organ involvement, it's a metabolic issues, it's endocrine issues. So there is no one magic cure for this.
What practical advice would you give your listeners today?
Okay, when you ask about practical advice, I have this something called 20% rule. So in 100% of your lifestyle, 20% goes to a good diet.
Okay.
Good fiber intake, healthy food, healthy diet, less processed food, less sugar, less gluten, So this is what you're looking at. Next 20% goes for exercise, which means your physical activity. You have to do either your yoga, your walking, at least walk 10 to 20 minutes after every single meal. That is very important.
Okay.
So exercise is very important. The third factor is your sleep. You need at least 7 to 8 hours of sleep every single day. That is very, very important. Sleep which is lost, you cannot be catching up on it at all. All right. And the fourth 20% comes from your stress level, your emotion, your mental well-being. So that is where it contributes. So you need to know how to manage your stress, because increasing stress increases your inflammation and worsen your conditions, your health issues as well. And the last 20% is where it comes from your doctor, is your supplements we are talking about here. So the 20% efforts come from your doctor, 80% comes from your side. So when you combine all these 20%, then you become 100%.
100%. That's a very good strategy, Dr. Suganthee.
Yeah.
Did you make that up yourself? Or
Yes.
Wow, that is very interesting. I think everybody should try to some way or form apply that in their lifestyle and at least
Definitely.
a guideline, right?
It doesn't really apply for PCOS alone. It applies for all medical, general thing, all medical issues as well. For a healthy living, I think this is something that everybody should apply.
Okay. If you could leave listeners with one message, right, like for them to take home, right, or actionable things that they could do, right, what would it be?
Okay.
Yeah.
See, many women suffer alone with a lot of conditions. So when they complain, they're feeling tired, they're feeling depressed, they're feeling anxious. People says, or people who are close to you says, it's all in your head. It's not in the head. There are things going on in your body. You don't need to suffer alone. Seek your physician's help, Don't look into your body. Any small changes, notice it. Go and find a doctor all right, and consult them. And you will notice that they can actually help you to resolve your problems. You can lose your happiness, your self-confidence just because of having all these problems. So when you interfere early, all these problems will just vanish eventually.
But do you not think it's because of the way how Asians are brought up? We are shy.
It's not only
we are very
Asians, I think
reserved.
worldwide, that's how the
Yeah.
concept people look at women, right?
Yeah. We are all very afraid to see the doctor.
Yeah, they
and
think it's
everything.
normal for a woman
Yeah.
because she's having a menstrual cycle, she's having a PMS. Her PMS symptoms can be very mild. She don't need to suffer so much. So all these problems are rectifiable just by correcting the core problem. That's what she has.
Okay. All right, let's do a quick can or not session where we ask Dr. Suganthee about some question that is very common and hopefully could be easily answered with a yes or no. Can someone have PCOS without ovarian cysts or not?
Oh, yes.
Right.
You can definitely have a PCOS without an ovarian cyst. You can have a normal looking ovaries, but you can have the other features of PCOS. Yeah.
Can someone with PCOS get pregnant or not?
Yes, a patient with PCOS, yes, can get pregnant either naturally or with a little bit of medical assistance.
Assuming if somebody who has PCOS do not do anything about it, can it go away naturally?
Okay. PCOS, as I said, it cannot be cured. It's a lifestyle management. All right. You need to manage your life, take a bit of good supplements, certain medications to keep it under control. So, no, it cannot go away.
Right.
It's a lifelong management you're looking at.
Okay. Can PCOS cause weight gain that's difficult to lose?
Yes, PCOS can cause weight gain that's difficult to lose. That the core issue, as I mentioned, is the insulin resistance. But you must understand 25% of people with PCOS also is very lean. They are very lean. They are not on the overweight side. But the rest of them, majority of them, have issue with weight gain.
Right. Can acne be a sign of PCOS?
Yes. Okay, hormonal acne is usually the cause for PCOS. And just to go a bit deeper into it, a lot of girls, teenagers have so much of acne on their face. They go and see a dermatologist and they put them on Roaccutane or antibiotics for several months. All right. And when they stop those medications, the acne comes back again. So they must realize this is a hormonal problem. So if you wanted to keep your acne at bay, all right, you want to make it disappear, you have to make sure your hormone is corrected. Your acne will go away for sure once your hormone is managed properly. And taking those antibiotics and Roaccutane will actually affect your gut microbiome and worsens your PCOS as well.
Dr. Suganthee, can stress alone cause PCOS or not?
Okay. I would say no. Stress don't cause PCOS. Stress actually can add up to whatever is going on with PCOS. It increases the inflammation level, the severity of whatever is going on. So it doesn't cause PCOS. This is not the cause factor.
Right, it's not directly.
Yeah.
Okay, we have a few questions asked from our viewers. Doctor, what does being healthy actually mean in today's world?
When you say being healthy, that means physically you have no issues, you're functioning, I got to say functioning very good, you feel happy, you feel confidence, you can carry your day-to-day activity without any issues, And other than that, definitely you're eating healthy, you're doing your exercise, you're sleeping well, all right? You're able to manage your stress fair bit quite well because in this world you can't avoid stress. But as long as you know how to manage your stress, that is very important. And of course, based on your age, there will be certain supplementation that you need for it to sustain and to go on. So as long as you can take something basics, whatever needed or deficient in your body, and you fulfill the rest of the criteria, you don't have any complaints per se, then you're considered quite healthy.
Okay. Is exercise more about consistency or intensity?
Okay, exercise is more about consistency, all right? Intensity, it depends on what age group and what you're aiming for. Okay, especially if you're talking about women above 50 or postmenopause or menopausal woman or perimenopausal woman, we are looking at a bit of intensity along with it. So we usually advise them to do weight-bearing exercise to strengthen their bone, their muscles. So exercise have different types of exercises needed for different age group as well.
Why is sleep often overlooked as part of the health routine?
Okay, probably they think we sleep 4 or 5 hours, they think it's sufficient, or sometimes many people think you can actually catch up on your sleep. I sleep late every day, probably Friday night or Saturday night.
Does that not work?
No, there's nothing called catching up on your left or whatever you have left out with.
Okay.
You have to have a proper sleep almost every day. Once in a while, having a late night sleep, that's not a problem, but not on a regular basis.
Right.
There is a big theory behind it. You do secrete something called melatonin from your brains. It usually happens sometimes between 11:30 to 12 to around 2 a.m. in the morning. And this melatonin plays a role in eating away all the bad. It stimulates this good cells to eat away all the bad cells in your body. It can be your cancer cells, tumor cells, any disease that's happening. The repair process takes place during that 2 hours period, roughly around there. So if you miss out that deep sleep, this usually occurs when you have a deep sleep between 12 to 2 a.m. So what will happen? Your body's repair process is failing. So over a period of time, all these tumor cells accumulate. That's when you'll end up having a cancer, and then you start having certain disease, which is non-reversible. The damage becomes more permanent. So your sleep is very important. Try to go to bed around 10 a.m. if can, the latest. And you need about 7 to 8 hours of sleep every single day, if possible.
With all the stress these days and anxiety, how could someone like us improve on our sleep? Assuming if you want to do something about it.
Okay, it also depends what you take the whole day, your caffeine intake. Okay, your lifestyle, your self-management. There are many ways of managing this kind of stress on your own as well. All right, avoid using all these phones, all the excessive lights just before going to bed. That will be very helpful. And sometimes consult your doctor if your stress level is really too high, you're unable to sleep. The doctor can assist you. They can give you certain supplements which helps you to sleep, and it also can address the problem and helps you to solve it.
What are some, you mentioned about talking to doctors, what are some health screening people should not avoid?
Okay. The health screening, by right, it should start at a very early age. Usually, even at the age of 19 or 20, you can start your health screening. All right. So, for women, the health screening varies. They have certain screening that is necessary to do, like a pelvic screening, breast screening. So, because the incidence of many cancers has been going up. And if they experience any hormonal imbalances early in life, which can be detected at a teenagerhood as well, they have to consult and check early. So you can do your health screening based on your family history, your genetics. Also, if you are experiencing any symptoms, the doctor will decide what will be the right screening for you. So consult a doctor. They will advise you.
Doctor, just now you mentioned that from 18 to 19 onwards, a lot of people in their mind, they would think is it too young? I'm still young. Do I really need to go to the doctors? What do you say to that?
But I would say it's changing now. I do get a lot of girls who are in the 18, 19, and 20s. At very early, even 16s, I do have. Parents are bringing them when they are much younger, whereas those who are 18, 19, 20, they come on their own. All right. The awareness for health screening has increased. They know they have to screen themselves. Probably if everything is good, they will do it 2 years once screening. They might not need every year screening. So the doctor will tell if they find something, how often you need to do your screening.
Thank you, Dr. Suganthee, for such an insightful conversation. And thank you everyone for listening to the Can or Not podcast. Protect your peace and your gut with Akeso ProbioGut. Check our social medias and our website down in the link below. Like, comment, share, and subscribe. And if you have any questions, please leave them in the comments down below.